Hello and welcome to Survive. The novel coronavirus has been a worldwide epidemic right now. If you can prevent getting infected from Covid-19, it's really worthy for you. So we discuss Ayurvedic precautions and modern techniques to prevent the infection of coronavirus. Please subscribe to our channel if you haven't subscribed yet and click the bell button too. Basically, what is coronavirus? This is a group of viruses covered in little protein spikes which looks like a crown or corona in Latin. There are plenty of known coronaviruses. Among them, 7 types are infectious to humans. The SARS or Severe Acute Respiratory Syndrome pandemic in 2002 was also a coronavirus. The coronavirus responsible for the present pandemic is SARS coronavirus 2 or Severe Acute Respiratory Syndrome coronavirus 2. In the earlier time of this pandemic, it was known as Wuhan's coronavirus or novel coronavirus. And later, disease was renamed as Covid-19, which stands for Coronavirus Disease 2019. This was initially found in Wuhan, China. It gradually spread and by now it has become an epidemic throughout the world. Let's see what are the symptoms of Covid-19. Mostly it shows symptoms similar to common cold, and one thing you have to remember is even someone is infected with novel coronavirus, it is more likely to show no symptoms, especially if the person has a good immunity. We explain symptoms for your knowledge only. If you are not feeling well, please seek for medical care. And symptoms may vary from person to person and get severe with the time. For the first 2 days, just a mild sore throat without any other symptoms is seen. This may mimic to common cold. On the 3rd day, sore throat may become more painful and body temperature may reach 36.5 degrees Celsius. In some cases, less commonly, nausea, vomiting and diarrhea-like symptoms may occur. On the 4th day, sore throat may become more severe. Fatigue, multiple joint pain-like symptoms may also appear. And the body temperature will reach to 37 degrees Celsius. On the next 2 days, mild fever may be felt as body temperature goes high beyond 37.2 degrees Celsius. Dry cough and breathing difficulty is also seen in this stage. Day 7 is a special turning point. If the person is not recovered from Covid-19, the symptoms may get more severe and will require hospital admission. Headache is shown and severe diarrhea may be seen in some cases. On the 8th day, in patients with coexisting medical conditions, symptoms will be worsened. Marked shortness of breath may occur and body temperature may go beyond 38 degrees Celsius. According to studies, in 9th day, sepsis may occur in most cases. For the next 2 days, loss of appetite, abdominal pain, severe distress in respiration may occur while other symptoms remain. Patients may require emergency care in the intensive care unit. On the next 2 days, survivors show decreasing of the symptoms. Body temperature will be reduced to 37 degrees Celsius all over, but may show a dry cough. Meanwhile, in the other patients, symptoms tend to get more severe. On the next 2 days or on day 15 to 60, in bad patients, acute cardiac injury or acute kidney injury may occur. On day 17 to 19, in most fatality cases, death may take place in this period, mostly due to secondary lung infection or simply due to pneumonia. On day 20 to 22, survivors will attain complete cure and will be discharged from the hospitals. Now let's take a look how the virus enters our body. The novel coronavirus is an airborne disease. That means it's transmitted with the droplets laid out while the infected person is talking, coughing or sneezing, and also likely to transmit it with aerosols. So the portals of entry of novel coronavirus are nose, mouth and eyes. Let's discuss how to prevent the novel coronavirus infection. The main goal of prevention of the infection is to stop human-to-human transmission of the virus and to boost the immunity of individuals to fight against the virus. Tip number 1. Maintain social distance. Stay at least 2 meters away from others. Tip number 2. Wash your hands frequently. Use alcohol-containing sanitizers whenever possible. If those are not available, use any kind of soap you have. Washing your hands more than 20 seconds is recommended. Tip number 3. Wear a face mask only if you are sick, if you are taking care of a sick person, or if you are in a suspicious environment. Avoid touching the mask after wearing and dispose it after around 8 hours and wear a new one. Tip number 4. Make sure young children and elderly people are at home and safe, as they are more likely to have low immunity and more vulnerable to the virus. Tip number 5. Avoid touching the face, eyes and nose with your hands. Tip number 6. Avoid handshakes in greeting. Instead, use Ayurvedic, which means wish you a long life according to Sri Lankan tradition. Yoga bow is also an alternative to shaking hands, but it doesn't include a well-wishing. Tip number 7. Avoid crowded places and unwanted meetings. Stay safe at home. Tip number 8. Cover your coughs and sneezes with a disposable tissue or with your elbow. If tissues are used, dispose it in the proper manner. Tip number 9. Clean and disinfect frequently touching surfaces like door handles or tables. And try to avoid touching surfaces as far as possible. Tip number 10. Please cooperate your state government by following the rules imposed. Now let's move to the most important part of this video. Boosting your immunity with Ayurvedic herbs to defeat the virus. And please keep in mind, these are recommended for healthy individuals in order to prevent COVID-19. These are not medicines or treatment for those who are already sick with COVID-19. These herbs will enhance your immunity against all viral and bacterial infections. So this is kind of broad spectrum immunity boosters. Now you have to keep in mind that it's very essential to have proper digestion functions and good bowel movements in order to enhance your immunity. So the main goal is to improve your digestion and immunity. Take a mixture of below herbs, boil it in water around 30 minutes and drink twice or thrice daily instead of tea or coffee. If you feel any stomach irritation, take the mixture with meals. Number 1 on our list is ginger. It's one of the best digestive stimulators. Number 2. Roasted coriander. Roasted coriander seeds are traditionally used against fever and communicable diseases in Ayurveda. Number 3. Garlic. You may have heard some myths and controversial facts about garlic. Just garlic itself cannot prevent COVID-19, but still it can be used to enhance your digestion, metabolism and eventually your immunity. Now let's see what are the other Ayurvedic tips to prevent COVID-19. Avoid suspicious environments. Avoid wheat flour preparations. Drink lukewarm water frequently instead of cool water. Add more fresh vegetables to your meals. Drink fresh orange juice. Add banana, papaya, grapes and Indian gooseberries to your dessert. Do not work too hard, as it may reduce your immunity. Take at least an 8-hour sleep. Those are the key tips you should follow to prevent novel coronavirus infection. In certain countries, healthcare services might be overwhelmed due to huge number of COVID-19 cases. If you are from such country and difficult to reach your healthcare professionals, we will try our level best to help you through our distant online service. So if you need medical guidance, just feel free to contact us via WhatsApp with the number on the screen. Thanks for watching. Stay safe.